when you are in a resource limited environment, the resource you still have is your brain.
Hello, everyone, and welcome to Season 5 of the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are again joined by Dr. Csaba Dioszeghy, who is one of our founders and the CEO of CoROM. Csaba, I wanted to invite you to this special episode, which marks the start of our 5th season for the podcast, and also a new academic year in another month. So, Csaba, welcome back to the podcast.
Thank you, Aebhric. Thank you. It's a pleasure to be here as well, as always.
So tell us a bit about yourself and what's keeping you busy.
I'm a critical care and emergency consultant, and with lots of pre-hospital experience and helicopter experience, and I'm also a board-certified cardiologist. What keeps me busy is I'm the CEO of the college since essentially February, running now the new phase of the college, because what happened is that over the past 10 years, our college has grown into a substantial higher education institution. And now we need to consolidate what we have and hopefully, turn it into a university within the next, hopefully in 5 to 6 years. And that's a huge project we all decided to embark on. And that keeps me busy. There's a lot of things to do. There's also some new expectations from MFAGA, so the Maltese Higher Education Authority, where they want the online education to be a bit modernized, a bit more interactive, and overall a higher quality. They put a very strict quality assurance system, which we very welcome, because that makes our college, consistently high quality. So to meet all these expectations and to meet all the expectations of our students, that's a lot of work, and that's what keeps me busy now.
When I started this, and you were there as well, you've been around since before CoROM has officially became a degree granting institution, but it's always been a little different from traditional universities. How would you describe this? What is that difference? Why are we different than other degree granting institutions?
I think the main difference, and I would say our main value, is that we are fantastically adapting the need of our students, and our students are a bit special because it's a niche market. It's a niche, would I say, specialty. So Austere and remote critical care is where people cannot really always plan ahead. They need to adapt to what is happening around them. Our students are working all over the world. Actually, we had students from all 5 continents. They work for military, they work for NGOs, they work for offshore platforms and other areas. So it's extremely difficult to create a kind of traditional educational institution with academic years and lectures and so forth. So what we did, and I think that makes us very different than other institutions, is that we adapted to this system by being extremely flexible, asynchronous, which means that people can join when they can. They are doing a lot of things offline, online, wherever they are. And that's another major value of CoROM, is that even we are asynchronous online most of the time, we do have a faculty available at any moment. And I keep on telling it to all the students on the onboarding sessions, is that although it's online and you do it in your own pace, you're not alone. Our human faculty is around. It's essentially just a few days away for any discussion, online meetings, and one-to-one teaching. So we probably do more one-to-one teaching than group teaching or webinars. And they are highly valued and very effective. So students like this. And of course, we do have the Maltese classroom and campus-based courses, which are also, well, for a good reason, they are quite popular. And that's the other thing we are working on now. We are completely rebuilding our classroom and campus, and we bought a new facility there. So we are growing on that, and we put a lot of emphasis to listen to our students' needs and adapt And that makes it different from other institutions. I think other institutions that usually want the students to adapt to them. And we are doing another way around. We listen to what students need and try to follow them, because we understand that what they're doing is extremely difficult. They are in a resource-limited environment. They are austere environment, and we listen and we try to serve them to make sure that their education is not any more difficult than those who are, walking into a beautiful building in Oxford or Cambridge.
I do like that we listen to our students. Every time I'm in Malta teaching or online listening to a live webinar, I listen to the students. So, Csaba, how has student feedback influenced our curriculum?
Massively, massively. So, when I'm saying that we listen to students, I'm not just saying it because that's a nice thing to say. We do absolutely our best, but we're not always right. We don't always do everything perfectly. To give you an example, we did have a course a few months ago which didn't go that well, and we got feedback even during the course. Students said that they don't like this and don't like that. You, as the rector of the college, flew there to Malta right away. Took over, discussed with the students what they need, and we immediately acted. And one of the action actually is that we purchased the new facility and started to rebuild the whole classroom, because one of the feedback was that it wasn't very comfortable. It wasn't really as good. And why? Because that was, we got that about, when was it? 6 years ago, 7 years ago. And we didn't have much time to think about that. Is it too warm, too cold, too white, too blue, whatever. So, and our equipment was obviously used, and we had to renew everything, and that's what we're doing. So in this August, I'm flying back to Malta now in a few days, and spending my time with the builders. So we rebuild that. But what other things? We listen to the students for the curriculum as well. We're introducing new modules, for example, in the postgraduate program now. Extremely exciting. Still waiting for the MFAGA to finalize the accreditation. It's on the way, and so I think it's a good progress, but it's slow. It's a slow process. But there will be amazing new modules, and they are there because students wanted them. So yeah.
So yeah, I heard the feedback from the students in May, and I dropped everything, flew out 12 hours later, landed in the classroom and listened to them and changed things. Immediately made improvements, and the ripples of that are still addressing my day-to-day now. So I am completely revamping some of our classroom curriculum to be more of what I envisioned when I first started teaching, even in remote medicine Ireland 15, 20 years ago, and bringing in some of my passions and drive on this is what I really, really, really want our students to be fantastic at. And we're doing that. So we're updating that. And then you stepping into CEO, you've allocated funding for updating our equipment. We now have 2 campuses that are up and running. We're getting air conditioning into the bunker, which we've been in the bunker for 12 years. And 3 months of the year, we can't, well, as an Irishman, I just can't go there 3 months of the year because it's 42C, and you're changed that. You are bringing in air conditioning. You are completely revamping the bunker. We've rented the place right next to it, so we have a larger footprint there. And what's most importantly, I think, is we just continue to improve. I designed the Masters of Austere Critical Care was 6 years ago, and did 5 years of that, and then we resubmitted it just recently to double the size of the Masters of Austere Critical Care. Today, I am finishing, you'll be happy to hear because you've been on me for this for ages, I am finishing ACC 709, which is the medical support for regular warfare module of this new updated critical care master's program. And now I can focus on the prolonged care and the improvised medicine modules. And you yourself, you've been doing a lot of that as well.
Yeah. So this what keeps me busy. There's the other part of me being busy is that the new modules for the masters, and I work a lot on that. But you know what? I love it. I absolutely love it. It's not just a little bit different content. It's fundamentally different concept of online teaching. I put lots of interactive elements now. Obviously, because also we need to meet MFAGA's requirements about the interactivity level and things. But it just gives us so much more opportunity to 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 keep the students engaged. It's not just lectures. It's not about just listening videotaped lectures. It's about a lot of interactivity. So yeah, there are 20 new modules on the new masters, and as soon as it's accredited, finalized accreditation by MFAGA, it's going to be opened for all the students, and I will ask them to just go from the old modules to the new ones. Or we can actually use the old modules, so they are not disaccredited or something. They are still valid, but I just feel that the new ones are so much better that it's going to be I think it's going to be a huge success, honestly. And I love working on it. I absolutely love working on it.
Over the past 5 years of running the Masters of Austere Critical Care, one of the feedbacks that we consistently get, especially for those that aren't in Europe, is the ability to complete the program without having to travel to Malta. When I first started, I said, there's no way we're going to do a critical care program where you're not getting hands-on. And looking at the feedback, I see that there is learning, there is benefit for somebody who can't afford to come to Malta. So I'm thinking of some of our students who have enrolled from Sub-Saharan Africa and Asia. They just don't make enough money to pay a 1,500 euro flight to come to Malta and then stay in Malta. And we're not reaching those people who still need the austere critical care learning. So one of the changes that you and I have agreed on, that you can indeed earn a Master's of Austere Critical Care online, that you do not need to come to Malta. But on the other side of that, we've added a lot more modules that are hands-on in Malta, such as the improvised medicine, the ultrasound, the prolonged field care. There's no way you're going to get a PFC module that's online only. Like, hit the C button for covering your casualty. We're just not going to do that. But people can pick and choose with this new 20 module austere critical care program to the modules that they're passionate about, what they're interested in. And it also means for those who are in low to medium income countries can attend and earn this master's degree without having to pay for a flight to Malta.
Yes, absolutely. I think it is important. And I remember vividly when first we discussed this master's program, when was it? Probably 2016 or even before that. And I remember sitting in Malta at I think it's St. James Hospital. We just had a course there. I remember, Aebhric, we were sitting there and you asked me that, can we do it fully online? And I was the one who said, absolutely not. I cannot imagine somebody getting a master's in critical care without something hands-on. But in the meantime, the whole online teaching has changed. It evolved a lot. And it's a master's degree, so it's academic. It is possible to do that. We encourage people to come to Malta, and we encourage people to go to our clinical placements, which is now available in Tanzania and in Nepal as well. We absolutely encourage them, but it's not absolutely necessary. So if you want to do it fully online, you can do it, and that's okay. And that is why I make a lot of effort to make it more interactive, getting more academic content and assignments and more interesting. Oh, actually, assignments are extremely interesting now. It's not just simple. It's not boring essays. It's getting now more and more exciting. So yeah, the opportunity to do this fully online is one big thing which was developed because we listened to the feedback from the students. But the other thing is that we're also working on with partners around the world and hopefully having a few modules and placements available in other parts of the world. Well, that's another interesting thing, Aebhric. We might, listeners might be interested in that. We are establishing our branches, and the first branch will open in the UK, and probably another branch will be in the US, and who knows where else in the next year or two. But that opens the opportunity to probably organize courses outside Malta for certain modules, which then can be RPL'd into our main program. So for those who doesn't want to travel, we are working hard on finding ways that we still provide opportunity for hands-on practice. So the point is, yeah, people can do fully online masters, in an absolutely flexible way. And there are human faculty behind that and available with very short notice. And we work, that's interesting that we have established now a fully new central admin. And that was another thing that we listened to students. It was difficult because it's an online education. It's sometimes not easy to get quick contact with the faculty. And we had one of the feedbacks was that it took some time until a student got a direct contact with a faculty member. So we established a central admin office, which is essentially 24/7, 7 days a week. And I'm not saying that physically we can respond to everything within an hour or so, but we really aim to respond within 1 or 2 working days and get all the problems addressed. And I think that's a huge thing.
That has been something we've jumped on with student feedback, and you completely redesigned the back-end office. You and Esther have created a central system that all of us faculty can access the information and the student data, and the students can access their own student data as well as reach any of the faculty that they need to very quickly. And that was from student feedback.
Yeah, it is funny. You might think that it's easy for a computer system, or you just buy a computer system which keeps the students' data and grades and things, and just get on with it. Well, it's now probably the 6th month we are establishing this new system and filling it up with all the data and synchronizing it. And we need to fix, an airplane while it's flying. It's not easy, but it's challenging, but extremely rewarding because the new system that will help us to get all the admin and all the academic admin beautifully streamlined. I hope that the system will be fully functional from September. That's what we're working on. And it's hard work. It's constantly adding data and adjusting things and.
So just in time for the autumn semester.
Yeah, absolutely. So when I took over the tasks, I set up a timeline, and my timeline was that from September, we should get all these new things in place. And I think I'm happy to say that we still stick to the timeline. So we're not behind what we wanted. There are a few other things actually might be interesting for listeners is that, for example, the membership system. So we are now completely revamping the membership system. The community of CoROM is an enormous value, and we want to value this, but we also want to give the name CoROM a special meaning and a value. So those who are members of CoROM will have that special value, benefit from this special value. So from September, at the moment, we're completely bogged down, obviously, with the new content and the academic part of the things. But once we completed these academic challenges from September, we turn our attention to the CoROM community and create the new membership system whereby being a member or a fellow of the CoROM will be a value, essentially. Something which you will be very proud.
I started the Council of Members because, again, feedback of people who were students or alumni and are people who could never attend, but they still wanted to be part of CoROM. So we started the Council of Members, and now we're completely revamping it and updating it. And stay tuned. We'll have a dedicated podcast that'll describe the new system.
Yeah, that's so. Yeah, what else? I might also mention our digital library. And the digital library is a success and a failure at the same time. I must admit, it's a success because we pull this together nicely, and our field guides and later any other publications will be available there. And the system is brilliant. The failure part is it's probably because we're not very much IT geniuses, but to put this library to the Android and OS App Store, it just takes ages. I mean, the amount of difficulties we got into, these technical difficulties, is enormous. So it will be done. I can tell you, everybody, hey, don't worry. It will be done. Absolutely will be done. It's not something which we cannot do, and we already paid for it. So just the delays are mind blowing. But once we have that, now everybody can have it on their phone. It's going to be the CoROM digital library, and you will have all the available publications, on your phone, online or offline as well.
We're not the best of IT. I know you gave me that task, and I had it for a fortnight, and I struggled and struggled. And I'm not an IT guy. I was an 18 Echo 25 years ago, and I can't really verify that I'm current by any means. And I handed it back, and we wound up getting an IT person from the Codeby site themselves that will help us with this. So by the beginning of the 2026-2027 academic year, we hope to have this app, which you can download from either of the Play stores. You can sign in with your student ID email, and then you can have offline access to field guides to the compass. We'll have additional content up and available for you as we go through, and it'll be a far better system than the one we had before.
Absolutely. So I have to apologize because I thought it's going to be a 1 or 2 weeks project to set this up, and it's now ongoing for 3 months. I hope it's going to be much faster, much sooner than the 2027 year. But we're working on it. Actually, I just got an email from the team this morning, so I need to read that and act on it. But it will work. But that's, if you put all this together, we are now set up a central academic admin back office, which serves the students and really serves the students. We have re-established our content creation system. We have now new content being developed, and quite a few is ready. I would say about 80% ready to roll out. We're just waiting for the finalized accreditation process by MFAGA. That's huge. We have a new CPD training facilities. We have, actually renewed many of our equipment. We are rebuilding our campus. We have actually 2 campuses now available. We have a new course calendar booking system. Our online platforms are also renewed. We are moving away from Google Classroom into Moodle, which is a state-of-the-art online learning platform. We are going to have a new membership system, and we're having a new online digital library system. All of these are still kind of in the process of being completed. But I can tell you, CoROM from the next year going to be absolutely fantastic. All of these will be fully functional. And I hope that from September, all the academic part will be fully functional. And from January, everything will be fully functional. And I really, really want everybody to come to our meeting at the end of January, where I hope that we will have the opportunity, Aebhric, John, and myself, 3 of us as the founders, is to present all these things in one big lecture or something, and celebrate everything which our team, the large team and all the faculty and all our students achieved over the past year. I think that's going to be an important milestone, because we grew up as a higher educational institution already. We just completed a large audit, a quality assurance audit by MFAGA, and I just got the letter from MFAGA a few days ago that we've been again relicensed till 31, at least 2031, as a fully accredited higher educational institution in the European Union, and we are on a path to become a university I think in the foreseeable future, and we're working well. We're doing well, and I want to celebrate it in January, and I think we can in January.
I look forward to that, and I think this first reaccreditation every 5 years, every MFHEA university, a higher education institute, has to pass an audit, and this is our first one, and they say that it's the hardest one, and it was bloody hard, and we went through the ringer, and with a fine-tooth comb, they looked at everything, and we passed. And we now have, again, a license for 5 years. And next time will be easier, and partly because of the systems that you've put into place, Csaba, to make this a more clear and excellent system. And I just do not want to go through an audit like we did last time of 2 years of, well, it took 18 months, didn't it? And we are good. We're up and running for 5 years. And in 2031, I will hopefully take a back seat and watch everyone else do all the hard work and getting it reaccredited again. But we'll see how it goes. So yeah, that's a lot to celebrate on our conference in January. And hopefully we'll have our Masters of Austere Critical Care approved, up and running. Our Bachelors of Remote Paramedic Practice is just about updated. We've been going, me, John, and faculty have been doing lots of back-end work to upgrade the online content. I am upgrading the classroom content. So when they come to Malta, I refuse to have a single PowerPoint lecture that from hour one, day one, to the end of their paramedic practicals, they are hands-on and have vast amounts of what I call hand knowledge as well as head knowledge as they complete their paramedic training. Csaba, my final question for you is this. What advice do you have for the new medic, the new doctor, the new nurse who is just starting out in their career in austere medicine?
Well, that's a hard question. Number one, don't give up. And the second is be able to think outside the box. That's a very interesting paper. I've actually just done a big literature review about fluid resuscitation and fluid use in remote and austere environment. And it's very interesting to see that most of the clinical guidelines around the world are based on the well-resourced Western medical environment. And they don't always work in the resource-limited areas. And we need to understand that. Because if we don't, and we just push everything by a guideline, we might cause harm. So I think the only way to mitigate this risk is to understand more about the physiology. So your question about what is my advice for the new medic in these challenging environments, my first advice is try to understand physiology. Try to understand what we are doing and don't just follow blindly guidelines. Always ask the question, why? And what happened if? And it's not enough to have pattern recognition. We need more understanding, because when you are in a resource limited environment, the resource you still have is your brain. And that is what can be used as a surrogate for high-tech equipment. So yeah, I think my advice is understand the physiology, think outside the box, be innovative, and be brave, and don't give up.
That's good advice. And Csaba, it's great to have you back here on the podcast. And it is great to have you leading the college. And you have added so much to CoROM, and it's an honor to walk this path with you.
Thank you, Aebhric. And it's a team effort. We all know that. And I'm honored to do what I'm doing. Thank you very much. Thank you.
This has been a presentation from the College of Remote and Offshore Medicine. If you found today's conversation useful, share it with a colleague. Thanks for listening, and we'll see you again next week.